Hello, everybody. Glad to see your faces. So happy you guys could be here. It's going to give a few more minutes for folks to get in from the waiting room, and Mark is going to share his slides. And if you are familiar with Zoom, you can go ahead and put your name and your organization, and if you want to share which coalition you're part of in the chat box, that'd be awesome.
Do you see the slides, Alana?
Yep.
Great. Aloha, everyone. Thanks for joining.
Oh my goodness, I have been talking the whole time, you guys. I have been on mute. I'm so sorry. I thought I was off mute. So I was just saying that thank you all for joining today. What we use these calls for is an opportunity for us to provide updates and for us to have you guys share your best practices, your resources, an opportunity to hear from you guys what you're seeing out in the field and some ways that we can be more supportive of your community coalitions. So next slide, Mark. All right. So just, I'm sure most of you are pretty familiar with chat, but if you do have any questions at any time, you can do two things. You can either unmute yourself or you can put them into chat. And I see a lot of you are putting your name and your coalitions and your organizations into chat. That's awesome. So again, if you do have questions, comments, maybe there's resources that you want to share, you can go ahead and put that into chat. And then for those of you who maybe are new to Zoom, which is highly, highly doubtful, if you hover over the bottom part, you'll see a little green, you'll see a microphone, and that you just click that and that's where you unmute yourself. So, next slide. All right, so for today's agenda, we're going to go through, we're just going to do some updates, and then we're also introducing one of our newest team members at Mount Pacific. And then Caitlin Conway, our new task order director, is going to provide some updates. And also we'll have our team provide some updates on vaccines and then some upcoming events from Mount Pacific And then our data analyst is going to provide some updates on opioid data. And I'm going to do a brief little intro, maybe not so much an introduction, but more of a presentation rather, on social determinants of health. And then we're going to provide some opportunity to hear from all of you. So just to kind of prepare yourself, any challenges, any current coalition projects that are going on, what are you guys doing? What are you seeing out in the field? How can we be more supportive at Mountain Pacific for your coalition work? So just to give you some ideas of some of those round robin topics that we'll ask of you later on. Next slide. So again, our new task order director, you guys may have seen Mary Erickson previously as our task order director. We now have switched gears a little bit. Mary Erickson is still with us at Mountain Pacific, but she is in a different capacity. And so we have our fantastic Caitlin Conway stepping up to that role. And I believe she was going to join us by phone. So Caitlin, if you are available, if you want to just provide some updates from Mountain Pacific and any CMS updates.
Hi, Alana. This is Caitlin. Can you guys hear me okay?
We sure can.
Yes.
Perfect. I apologize, but I was only able to join by phone today. But I thank you for the really warm welcome. As she said, I am the new program director. I'm very excited about continuing to work with you all. I was previously our patient family engagement and chronic disease lead, so I'm very familiar with the amazing work the coalitions are doing and happy to see that continue to carry out. We are continuing to work in all the same areas since the onset and will continue to do so. We have, of course, added on some great work happening around immunization. So I'm sure you've seen a lot of that coming out, not only through your coalitions, but also through the communications you receive from Mountain Pacific. So more to come and see that coming your way around COVID-19, influenza, and pneumococcal as well. I just appreciate all your time and being part of these and continuing to work through this wild world that we live in today. And we appreciate the partnerships, the collaboration, and all the hard work you're doing, and just look forward to continuing the work with you. Thank you.
Awesome. Thank you, Caitlin. Excuse me. And I'm sure, as most of you know, there's a lot of pivoting, a lot of flexing going on. And I think we definitely want to put a big plug into just thanking all of you for what you do day in, day out. Some of us on the line are probably on the front line doing direct patient care. And I know right now it's not easy, and we just wholeheartedly appreciate the work that you're doing. And we want to give a big shout out just in also honor all of those frontline workers, the providers, nurses, housekeeping staff, everybody who continue to fight the fight with COVID and the Delta variant. So thank you. And then some vaccine updates. We're going to do that in just a minute. But we did want to provide an update. We have a new team member, and I'm just looking for her name on here. I don't see that she is on, but maybe she's on by phone. Her name is Emily Burton. She is our newest account manager at Mountain Pacific. She joined us just a little over a month ago, and she's been fantastic. She's taken on the role of helping with some coalition work in Montana. So I just want to give a big welcome to Emily, and you'll probably see her name more often. So I don't, if Emily, you're on by phone, I'll pause for a second. And I don't think she is, so we'll just move right along. Next slide. All right. And Mark, I'll hand it over to you.
Hello, everybody. And as Alana was just saying, we're really grateful to all of you and all the work we've been doing over the past 2 years. Looking forward to our new contract mod and moving forward in a lot of different directions, and many of the same. So thank you all, and we appreciate your participation in both the coalition work and in these coalition meetings. We have created some resources out on our website. These resources are listed here on this slide. You can sign up to receive on-demand resources geared towards providers, patients, and also different types of communications. You can start receiving vaccine education emails if you'd like. We're trying to do bite-sized pieces of information that come to you just in time and are surrounding the different vaccination issues that we have, from hesitancy to flu and pneumo, as well as Shingrix and some other areas that come up. The pneumovax and flu seasons are coming, so please take a look to see what we have out there and see if we can help you out and continue to support the community work, both in person as well as hybrid in the virtual meetings that we have. So next slide. Upcoming events. We have the 3D Echo and the Echo Hub with Mountain Pacific and Frontier Psychiatry. Dementia beginning October 13th. It's a 10-part series. It's the second and fourth Wednesday of the month. Our next regional coalition lead and all member quarterly meeting is January 11th for the lead and January 25th for the member meeting. Our GWEP meetings here in Hawaii for the GWEP team. Next one will be November 9th, 2021. It's the second Tuesday of each month. That will be a 12-part series. And the Guam Diabetes Conference will be in November on the 14th. So we'd like to turn this over at the present time to our analytics team, either Dominic or Ray, to talk a little bit about where we are right now with our platform and how we're portraying the data that we have. You folks have your own slide?
Hi, yep, this is Dominic. Hi, everyone. Yep, I just was going to share my screen.
I'll stop sharing.
Yeah, hi, everybody. Well, we have released our latest round of reports based on opioids and beneficiary demographics information from analytics. So I'm just going to share a sample with you to give you an idea of the data that's contained in there. A lot of you will already be familiar with the utilization data and immunization data that we have created dashboards out of and also released these PDF reports. So our next step is to translate some of this other data into our dashboard. So I'll just give you an idea of what data is in there. I'm sure you'll take some time to review yourself, but we're always really happy to hear some feedback. So what we're including in this latest report is you'll find there's a summary at the very top that gives you an idea of what's going on with the beneficiary population. Here for this sample, there's showing a 7% increase in the population over the last 4 years. And we're also including data on opioid-related adverse drug events and also a comparison of the state and national opioid dispensing rates trends. And there's additional detail in here on which diagnosis codes are rolling up to support the data and where we're getting some of that public data from CDC, what the analysis timeframe is, and just some additional housekeeping information in our usual data sharing parameters around small numbers and those things. So in your own report, you'll see just a simple demographic breakdown of your beneficiary counts from 2017 through to year-to-date 2021. We're including a population breakdown by gender for each year. So you'll see the total beneficiaries and the percentage that are male, female. And we're also changing up our reports a little bit at this point to provide kind of an easier interpretation of the data for each table. You'll see we're including an interpretation now rather than just a description. So just as an example, in this coalition region in 2017, there were this many beneficiaries, 51% were male and 49% were female. So something simple like that, but we're recognizing that our coalitions have quite a bit of diversity of membership. So hopefully this helps to make the data more digestible and just easier to understand on first read for everyone. Included in the demographic breakdown, we're also including the race ethnicity breakdown in here. So you can see the trends across each year and the breakdown for this sample. Of course, that'll look different for everyone's unique region. Just a note here, I think particularly for the Pacific regions is that these are the Medicare, Medicaid billing designations for race and ethnicity. So they really don't have much of a fine degree outside of the major categories. So I'm sure you're really familiar with how that works. So you may see a lot of unknown categories depending on the population that you work with. So just something to be aware of. We're also including something that we think is helpful as we're going forward and trying to focus more from the data perspective on equity and identifying disparities. So we're including the population beneficiary breakdown by disability status. So there's the percentage of the beneficiaries per that year that were noted as having a disability or were dual eligible. So hopefully that is useful too. So just something simple for demographics, since a lot of our feedback was that our coalitions would like to learn more about what's going on at the high level amongst their beneficiaries. So just a couple notes about the opioid data that we're including in here. Once again, based on the ICD-10 coding for opioid-related adverse drug offense. At the very top, we have a breakdown of the total opioid claims for ADEs for each year, and the breakdown is by race and ethnicity, and also includes an interpretation. We also have that broken down by gender here. Just a note here for the 2021 data, there really was a kind of a lack of information across the board for opioid claims. We're seeing again, similar to healthcare utilization and encounters, diagnoses, things like that, they really dropped during COVID. So we saw the same thing. For some cases, we actually didn't have any claims data to include for 2021 year to date. So something really interesting to note there. Still may be going on, but it could just be that is not being recorded or it's related back to utilization. So we're trying to look into that more on your behalf. So the last piece of data that we're including is the comparison by year of the state opioid dispensing rate versus the national, and then a trend of the difference. And that is plotted here in this graph. So you can see this is just really simply from 2017 to 2020. In blue, that's the state opioid dispensing rate, and the national rate is in red. We also have a breakdown too of the opioid claims by the code groups. So essentially we have opioid use disorder and medication assistance treatments. So you can see those parsed out and separated here, included with a rate per 1,000 amongst the total beneficiaries. And then as always, we include definitions in our data sources. So I'd encourage you to have a look at these so that you can really understand the data that we're producing. Some of this data, of course, is billing data. So it's coming from our data sources from CMS, but some of it is also publicly available and we're reinterpreting it for CDC. So this data should be interpreted and translated into a dashboard in the very near future, and that will be available for our account managers to display live during meetings. And I think that is all I got from the analytics perspective, but we're always open to hear feedback and input. We love to hear what you think, and these reports and dashboards are always an evolving product.
Thank you very much, Dominic. We really appreciate the work you guys are doing. I also, in the chat, Crystal added some information on Project First Line. So I did add that to the updates. Crystal, I'm sorry I didn't have that in the original slide. Thank you very much. And so we have a couple of polling questions that we'd like to ask. And the first one is dealing with emergency management. It looks like this will be a part of the contract modification that's coming, and this will be looked at regularly. So we're interested in your responses. Wow. So people go ahead and jump in there. And the second question is, do you need help with your emergency management plan? Let us know.
Awesome. And I think, am I up next, Mark?
Yes, you are.
All right. If you want me to start screen sharing.
Okay. Boom.
Okay. All right. And while you guys are, we'll just continue to let you guys answer that polling question, because I think there is another question after this one, correct?
Yes.
Okay, yep. So I'm just going to go through a few things. You know, as Dominic was talking through that data, you know, he talked about breaking down with those, you know, age and sex and ethnicity. And I think just lending a little bit more information on social determinants of health and what that means for us moving forward. And I think most of you probably have seen a lot of that coming down the pipeline with CMS and CDC and NIH, and everybody is talking about how do we start addressing the inequities of care and in our communities. And so we just wanted to be able to provide a little bit more, you know, information and evidence-based tools that provide some context for what that looks like. In addition to that, I just also wanted to put a plug into those community dashboards that will be shared during the community coalition meetings. I invite all of you to attend those meetings. However, I also, it is a requirement for you to sign a participation agreement in order to view those. And that's just part of that logistical part from CMS, because we are sharing that claims-based data that you sign those participation agreements. So if you have not signed that yet, if somebody from Mountain Pacific wants to plug that into the chat box, that would be awesome. You could do that. So, all right, are we capping the polling results? Is this the final? And then here's the second polling question here. Do you collect social determinants of data? So go ahead and answer that. While you're answering that, I'm just going to move forward. Can you see my screen? Yes. Okay. All right. So this came across to me from American Hospital Association. So they partnered with the a few big names, national names. So one of them, Catholic Health Association of the United States. So when we talk about how we start addressing communities and social determinants of health and health inequities, I think a lot of us have asked that question, what is social determinants of health, right? So according to Healthy People 2030, and I'm just going to read this verbatim, social determinants of health are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. And it talks about, and I'm just going to show you guys the screen here. It talks about the 5 domains: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context. And so when we think about all those moving pieces, and we think traditionally what our community coalitions have worked on have been mainly very clinician focused, very hospital clinic based work. I think more and more now we're seeing our community based resources being a huge part of how we see success in our community coalition work and how we start to address these issues and move the needle to start addressing this. So thank you, Crystal, for putting that participation agreement into chat. So the scale of transformation needed in communities can't be achieved through grants alone. And this is talking about when we start to do our work and we start to identify opportunities for improvement, or some people call them challenges or barriers, that we think that throwing a grant on top of it will make it better. But in fact, you know, when this talks about grant meets immediate needs, investments create long-term solutions. So how do we invest in our communities? How do we invest to make sure that our work, our hard work that we're doing is long-term and then sustained throughout our communities? You know, we look at grants to address housing, you know, housing vouchers and workforce training, transit passes. You know, those are immediate needs that we're seeing right away, which is totally needed and fantastic. But how do we invest so that we have affordable housing in our communities, so that our, you know, there's low income housing? And specifically speaking, I can speak to this from a community coalition that I work with in Bozeman, Montana, where that median house price is around, I think it's $690,000 right now. And I'm just appalled, I guess, because as a nurse, I would think on a nurse salary, there's no way I could afford a house, you know, on that median house price. So how do we make this equitable across our communities? When we talk about upstream community investment and social determinants, what we are not talking about, we're not talking about moving healthcare outside. So we're not, although we do want to see mammogram bans and health screenings and telehealth and telepsychiatry, this is not what we're talking about, addressing the upstream and social determinants of health. And so what I'm trying to get us to all kind of focus in on is, what is that upstream? What are those community resources? What are we seeing when the patient leaves the hospital, when our residents are in the nursing home? What other type of community-based resources are out there that we can help them with? So I won't get too in deep with this, because I know we have other things that we want to present on today, but investing in upstream social determinants of health. And so just some opportunities that you can see here: financial resources, land, expertise, relationships, partnerships. Especially in our community coalition work, we've started talking about that. What does that look like? Who is that non-traditional community coalition partner? We've generally talked about care transitions, and we've wanted very important people there, like social workers and care navigators. But also, what about our librarians, our police officers, our transportation department, our workforce, Department of Labor? How do we get them at the table so they can give us that other perspective that maybe we're like, oh, okay, yeah, we're kind of missing the mark on this part of it. So how do we put the puzzle together so it fits right? And so hospital motivations for investing in social determinants. So again, a lot of this is very, it's very high level. It takes a lot of work. Just like with anything, it needs buy-in, it needs established partnerships, and we need to have a mission. So growing recognition that good health depends on many factors. Access to healthcare is a leading health systems to intervene in the social, economic, and environmental conditions experienced by the patients, plan members, and neighbors. And we also want institutional self-interest. So this is prioritized by elected officials in the community to help build that relational capital and goodwill, and regulatory compliance. I think as our boss is CMS, that's another overarching piece of that, but other regulatory compliances that maybe our communities have to serve. And then competitiveness, that how can we attract and retain, as we're looking at workforce shortages, what does that look like? What is appealing? And, all those other little bits and pieces, like I talked about with affordable housing strategy. Sometimes having that strategy reform to look at it in a different light, to understand this may be the strategy that we're taking, but is it going to actually show us return on investment, and return on investment, not only monetary, but actually sustainable changes in our communities that impact us for years and years to come. Reputation, that we seek recognition as innovators and field leaders. And Amanda, I also want to add disruptors, that we are thinking on how can we change a system. And then financial returns, of course. So this just goes through some of the examples here, and it talks about getting started. And so this tool here, let's see if I can switch this over here. This was the AHA Community Health Improvement. And so I'm going to stick this link into chat. And so for those of you who want to know more, definitely take a look at this. And with that, I'll pause. Anybody have any comments, questions? And I didn't see the polling result there for the social determinants of health measure. What was that polling question result? Oh, there we go. Okay. Do you collect social? So 53% said no, 29% said yes, and 18 are unsure. For those of you who do collect social determinants of health data, what type of data do you collect and what do you do with it? If you're comfortable, please by all means come off mute.
Alana, this is Catherine. So I know the hospital collects social determinants of health. And we probably could get access to it, although I don't know how they track it. And then I certainly don't know what they do with it once they've got it. So I'm not sure that as a coalition, I know as a coalition, we don't track that.
Mm-hmm. Yeah, and I think that's a really good point, is I think a lot of facilities do capture that data and do report it, but what happens to it after that? I think that's kind of the biggest question right now, is a lot of us are having, as we're ready to roll up our sleeves, right? We're like, what do we do? You know, how do we move with this? So I think it's being able to start to come together and having those conversations as a coalition as well. And I can see that a lot of us, you know, are very busy. If we are on the front line, if we are in a facility, maybe we're in an administrative role, and now we are on the front lines because we're so short-staffed. So we are having to take on a few more hats that we normally aren't used to. So how can our community-based organizations, how can our community coalitions help from the outside? How can we start to move that? How can we start improving? And maybe we don't have the question, but that's kind of the conversation, I think, within our coalitions as we think about chronic disease management, opioid abuse, and medication-assisted treatments through the ED, and whatever focus that your community may need to start working on. How are you stratifying that so you understand if your interventions are appropriate for your populations? Any other questions? I see Dr. Bergenich, you also had said the emergency management plan is confusing for me as who we are doing an emergency for. Mark or Maggie, do you guys want to expand on that? The emergency management planning?
With emergency management planning, what we learned from the pandemic was that we weren't prepared, whether it be from the person perspective or the hospital system perspective or the state perspective. And so I think it takes into account management from all those different perspectives. I know that CMS is looking at it initially from the concept of PPE, supply chains, making sure that we understand staffing from a coalition perspective, the role of partners, understanding decompression in every partner and in every step of every handoff, and then understanding how that works with visitation, and in particular, how do we include families, caregivers in these management plans as we go forward. So it is a huge issue, but I know right off the bat, from the acute care perspective, it's how do you manage the hospital itself and the skilled nursing facility? How do you manage them so that they are able to stay up and running and able to support the needs of the community as we have these different issues? The other one too, that we had talked about just a little bit ago were the determinants of health. And the one area that we are seeing here in Hawaii a little bit is what's called real data, race, ethnicity, and language. And we're starting to collect more data around that, but unfortunately, we know where and who is asking for that data, whether it's CDC or whether it's our departments of health in our different states, but we're not sure how it's being used. So Dr. B, thanks for bringing that up. We were talking about that too a little bit, and Alana, for what you were just doing with your presentation. So I think that's a piece that we're going to be looking at more again as the pandemic sort of expose where we were with equity and justice and different types of care that's being given, and the people who seem to have better access to care than other folks do, and how we're going to be targeting that. And I think we'll see this more and more going forward over the next 3 years as we do this coalition work. Did you want to share something, Maggie?
Oh, I just wanted to mention that I know one of our hospital partners reported that they do collect this data. And it's important for them so they can know, like, the demographic area, that they know their population and the culture, like who in the community that they're serving, like for the COVID long haulers, and what group that is, so that they can work on targeting their vaccination rates to help improve their, non-compliance with vax. And the other thing was the language for them to develop educational material particular to their needs and what their language is. So, it's good data. I think a lot of people do collect it. Whether or not, what they do with it is something we need to pursue, maybe strategize along the way in future meetings.
So Maggie, this is Catherine again. Just to be clear, I'm just curious because the hospital does a lot of all this emergency planning. Our particular Bozeman Health Coalition, Southwest Montana Health Coalition, doesn't do emergency planning. So it's a matter of finding out what the hospital is doing, or again, I'm just confused about it because I'm not sure how we impact the hospital, because I know that they're planning all the time. And so I'm not, maybe there's a series of questions that could come out that we could go to the hospital and say, what are you doing with these things? What is your emergency plan? What is your whatever? I'm just trying to figure out how, as a coalition, we would get involved in that.
Yeah, I hear you. I think it's at the partner level at each organization. And I know with the COVID pandemic, not only were the hospitals responsible for emergency preparedness plans, the nursing homes were impacted as well. And I'm sure even all of our other post-acute settings were under that dictate as well. So I guess it's at the coalition meeting that each of our coalitions participate in. Do we have updates on emergency preparedness plans, and what are they? Or maybe folks need like a sample of what an emergency preparedness plan is. Maybe that's something we can continue to work on together in these regional work groups. I don't know, but I think it's an opportunity that, we say, here's a sample of what it looks like, here's what's ideal, and, a recipe that works, or if it's not going to work for your area, we figure it out.
And I see, Carrie, you just said a template would be helpful. Are you referring to a template for emergency management planning?
Yes.
Okay. And I know there is some, one of which is from, I believe, CDC. Correct me if I'm wrong with that, but anybody have a template that they are willing to share for emergency management planning?
Hey, Alana, I know I collected a bunch of stuff a while back ago, but I need to go through it. And I can shoot it out. If I can find it real quick, I can put some links into chat. But yeah, that's something we can pursue and should follow up with.
Yeah, awesome. And in the meantime, our contact information, we can put some of our contact information into chat as well. So if you do have something, or you know of somebody within your organization that has that template, feel free to share that with us. But I'm pretty sure the last one that I had seen was from CDC. So, but we can figure that out and send that out later on. All right, and now I think we're at that point where we get to do some round robin. And so some of those, you know, the high-arching questions that I had asked earlier, you know, collecting social determinants of health data. What are you doing for chronic disease management? Are you doing work with opioid and working with a task force within your communities? We kind of want to hear from you guys. And any types of successes, any challenges, any resources, outcomes, mitigation strategies, anything you want to share. Now is your time.
This is Catherine again. Surprise, surprise. I can't necessarily speak to successes. Certainly there are challenges, and our biggest challenge is, of course, getting enough people in the coalition. I think that there are two opportunities out there that we're looking at, both within the coalition and more broadly around the state of Montana, which is two things. One is, as I talked before, about advanced care planning and figuring out how to educate not the docs, not the providers, but the patients, the people out there, so that they can go to their docs and say, hey, this is what I have, this is what I want to explain to you. And there are a number of conversation guides out there about how to have the conversation from a patient perspective that we're, I think next week I have a meeting with somebody here to see what we think would be the best one to use. The other thing that we're just starting to look at, and we have a meeting tomorrow about this, and this is more statewide, is the whole issue of, there's the opioid crisis, and then there's the persistent pain crisis. And there's a lot of data now. I just was on a webinar earlier today that was really quite remarkable, from this doc at Stanford about, well, the opioid crisis is real and important. There were a number of things that she talked about, but one of them is the opioid crisis has morphed into illegal fentanyl crisis. So it's not docs giving out meds anymore. It's more illegal fentanyl and synthetic opioids that are out there on the market, not coming from docs. And that a side effect of the opioid crisis has been all the people who are in persistent pain who are not being appropriately treated or don't have access to appropriate care. So that's a slightly different twist on the opioid crisis, but I think it's really something that is as important, and that hopefully I've been gathering materials, we can start looking at that from a community perspective. So that's what's happening in Bozeman.
Yes, thank you, Dr. B. I know I'm working with her on that opioid work, and it's the story that, or what she's referring to. This came out during the Montana Coalition Summit. So we've had 2 different coalition summits so far. Is the one in Wyoming, and then we had one in Montana. And so the first one in Wyoming, we were able to work with our Patient Family Advisory Council and some of our PFACs, including Sabina, who was on the call. And we just had an opportunity to pose a few discussion questions, and they sat on our call as a panel. And we just talked through just very frank, candid conversations about various topics. And one of those topics was opioids. And so from that one, we also talked about next steps, action forward, momentum is how to address vaccine hesitancy. And, that a lot of people, we kind of joke, as we're almost in November, I think a lot of us had high hopes for 2021, given that 2020 was just awful. And now that we're seeing that the numbers just kind of keep going up with Delta and things like that, it's scary, and it's just, we have a lot of uncertainty moving forward. And so talking about what that vaccine hesitancy is and continue to move forward. And I see that there's been a lot of really great campaigns. Yes, and thank you, Crystal, for shout out. Sabina Scheck and Mary Schramke and Eileen Ford were our PFACs. And then Maggie just put in a social vulnerability statement for 2018. But from those two coalition summits, we had some really good takeaways and some actions that we're going to take moving forward. And so for Montana, the one was the opioid work that Dr. Organich was just talking about with the, the other side of the coin with the opioid crisis, the pandemic with the crisis and everything else that goes along with it, that we still have people that have cancer and have true pain. And how do we continue to move forward with that? Because providers are so scared to prescribe opioids, and then how do you wean them off? And or if you can. So I think there's a lot of opportunities with that as well. Anybody else have anything to share, or any of our folks that were on those Montana or Wyoming coalition summits? Please feel free to add in if I missed something. And Danielle, I see you raised your hand.
Yes. Sorry, I'm echoing. Okay. Yes, I wanted just to share a big thank you for working together on the 3D Dementia Project ECHO. And I'm very excited about the series, and excited about discussing some possible implementation and what that looks like with members. So that's my big update. So thank you.
Yes, you bet. Yeah, we're really excited for the ECHO series there.
Hi, Alana, it's Crystal. Can I add something?
Sure thing.
Sure. I just wanted to bring forward that something that the Coalition Summit helped with our coalitions and grow. Actually, I had several new members this last week at our coalition meeting for the Casper area or central area. Was the summit helped us identify partners that should be at the table that weren't. And so we were able to reach out to those partners and invite them to our coalition meetings. And so a great way to grow them. So wanted to shout out to our new members.
Awesome. Yes. And I think that too is a really good opportunity to glean from, is when you are getting together and we do start having those conversations and hearing the community members' voice in our work through patient family advisors, caregivers, we start to understand where we may be missing the mark. And so some of the topics that we continue to work on, care coordination, care transitions, for one of them, that it continues to be a consistent issue in a lot of our states, a lot of our towns and our communities, and specifically our rural communities, and maybe underserved communities. So trying to think a little bit more outside the boxes to be able to help start addressing those inequities. And then identifying those partners that we can start pulling in that we just didn't really think about, but it helps us give us a new perspective.
We'd like to thank Danielle and Angela for attending our member meeting. We are working with Alzheimer's also as partners, so thank you so much. We really appreciate the work you're doing, and look forward to this platform membership meeting to work on other topics with you in the future too.
Thank you. Thank you very much. Absolutely.
So please don't be shy. If anybody has anything else out there, challenge that you saw as an opportunity that through some sort of mitigation strategy, you turned into an outcome that was favorable. I know we talk so often now that it's hard to find a success with so much going on, but we're sort of inundated with where we're at. But at the same time, there are small little steps and wonderful little things that happen here and there that make it worthwhile and continue for all of us to go on. So if you have anything else, please let us know.
All right, and I see that we have the evaluation link for today's call also in the chat. So if you wanted to take a second and complete that for us, that helps us to build on to what we need to. All right, well, hearing no other voices coming through wanting to provide any updates, we have that next Regional Community Coalition call, which is January 25th. And it is at 3 p.m. Mountain Daylight Time. And you do have to register in advance for these meetings in order for them to get onto your calendars. So you just go into our upcoming events on our Mountain Pacific webpage, and you can click in there and then you can register for that. And so that'll get on your calendar. And with that, I will put my email address into chat just in case any of you want to forward any resources, if you have an emergency management plan template, anything else, any burning questions you thought of after. Well, thank you all for joining today. I really, really appreciate your time.
Thank you.
Thank you.